myself Dr. Saurabh from Academy of Exercise Health and Therapy. I welcome you all on today's webinar of evidence-based practice by Dr. Parth Trivedi. He is a lecturer from College of Physiotherapy, CM Patel College of Physiotherapy, Gandhinagar, and he is also a freelance editor of Asian Journal of Orthopedic Research, and also he is academic editor of Asian Journal of Orthopedic Research and reviewer of Journal of Harmonized Sciences. So today we are going to have a webinar on evidence-based practice by Dr. Parth Trivedi. I'd like to welcome him. I think he's there with us. Yes, Dr. Saurabh. Definitely. Great, sir. Hopefully, all well there. Everything good. Yes. Currently, stay home. Staying at home. Okay. From where I am coming is into red zone. Oh. Hope pray for all that it will get green soon. Yes. Thank you. Thank you. So, sir, today it's an honor to have you with us at Academy of Exercise Health and Therapy. Thank you for spending time with us. And our participants are waiting eagerly to know about evidence-based practice. So, just can you please elaborate about it? What does it mean by evidence-based practice practically? Because theoretically everybody reads it, but doesn't it, they apply into the clinical practice? So, what is it practically? Yes. Dr. Saurabh, as you said, it is clearly in what we say in our field, or probably in India, we are still, a bit lacking in our clinical practice, wherein the implementation of evidence-based is a bit, what I would like to say is bit into a loophole. Yes. I would like to give you a short example. We have always heard a story of, when did the hen came first or did the egg came first? Murgi pehle aayi ya anda pehle aaya? So, nobody knows that answer. I was just going on before just starting with this webinar live session. I just thought that, I should also search it out whether it was hen or whether it was the egg which came first. So, surprisingly, I got a result stating it that University of Sheffield and University of Weimar have done a study on this, and they have told that the hen came first. Yes, due to some proteins and all those type. But I was into hurry to join you people, so I didn't read that article fully. Leaving apart when did the hen came or when did the egg came, that's a secondary story. But as we all know that evidence-based practice, yes, so we as a doctors, what we do, we generally do our practice. We treat patients, yes. So evidence-based, so on what terminologies or on what perspectives we are giving a treatment to a patient who is coming for a treatment to us. Yes, that is a basic question which we all need to understand. Yes, if a patient is complaining of ONE, just giving an example, osteoarthritis knee, I have 5 patients which are coming with me. One is of 50 years, one is of 60 years, and one is 55 years of, and so on, of ages. Will the treatment for all those 5 remain same? First thing, that is the basic question. Second thing, if not, what kind of changes can be incorporated into those patients and how? Yes, because you all know that we are working for the benefits of the patient. Yes, if the patient is cured, automatically our name will be there. Yes, so what are we doing is we are working for the benefits of the patient, and our ultimate aim is to reduce the pain and discomfort of the patient. Yes, so there are n numbers of patients throughout this globe where they are having this ONE process pain. So Dr. Saurabh would be giving another treatment, Dr. Parth would be giving another treatment, Dr. X would be giving another treatment. but on what basis these treatments are derived. Yes. So initially, there was a story that this person is giving a good treatment, so people would go to them, or probably I would say like mouth to mouth. Mouth to mouth publicity is there, yes. Mouth to mouth publicity is there, but on what basis? It is if now I was just talking to somebody yesterday. It is the patient right also to ask you that on what basis you are giving me the treatment. Why you are administering me ultrasound? Why you are not administering me IFT? Or why you are giving me static quadriceps? Why you are not giving static hamstring exercises? So evidence-based practice as per World Confederation of Physical Therapists, WCPT, it is nothing but an incorporation of decision-making process from the physical therapist and from the patient and also. Yes. So, and then combining with the systematic reviews. Okay. So, what is the thing is that we are having three components in it. One is clinical expertise. Clinical expertise means I am working in my clinical practice. I know that I have seen these many patients and these kinds of variation. So probably if I am discussing with you all, stating it, see, I have seen ONE patients, somewhere around 50 to 100 patients. I see there is a tibial torsion, or probably I see a femoral torsion in this, and I have corrected it through taping. So this might not be a study as in present point of time. Yes, it might not be documented, but once I am seeing the results, I need to apply it on number of patients. We have ethical clearance and everything. That is a secondary chapter. We would take it some other day, but then I need to document it. Then I need to ask my client also, my patient preferences. Yes, that are you really, accepting my treatment? Are you actually have trust in me? Yes. What are your preferences? For how much duration you can withstand, you can avoid these kinds of injuries. For how much durations you can have this kinds of, expectations, or what are your expectations? So this is the client preferences or patient preferences. And then the third point is best available research or evidences. Then I need to go and search it out. We are very much lucky that we are into an era, that internet era. So once we know, yes, one of my teacher used to tell that, somewhere around 10-15 years back, that everything is available on internet except your mother and father. But nowadays your mother and father are also available because they are having their WhatsApp and Facebook accounts. So through internet, everything is available to us. Yes. So there are three basic components. One is client preference, another is clinical expertise, and third is research evidence. So majority of us are having a confusion, always a confusion, that if evidence-based comes, it is always a research. No, it is not like that. Whatever you are doing, nobody can be wrong, because everybody has a similar same goal. The same goal is we are treating the patient for the patient's benefit. I or you are not going, intentionally you are not going to damage anything to the patient. Yes, nobody, no practitioner would do that. So what are the best available evidences? We would see that the hierarchy also as we go on with our discussions. Probably if I have a certain evidences, or probably I have done one case report also, that is also accepted as an evidence in the practice. So my sincere request to everybody is that you are supposed to incorporate all the three components. One is clinical expertise, another is patient preference, and third one is your research. Yes.
Sir, evidence-based practice, does it also include, sometimes you told about 3 points, 3 basic components. Does it depend that whatever we are doing, if there is not any available research till date, then we are doing it, we are finding it beneficial for the patients. Can we use it for the research purpose, or should we apply that and go for the research in which manner? Or we should try to go for research in which manner?
Yes, so it is a very nice question, Dr. Saurabh. This is the question which is into the current scenario also. You would have seen that we are not having any treatment for COVID-19. Yes. So what are people doing throughout the globes? Yes, you would see that there are different kind of drugs into different phases of clinical trial, or probably somebody says it is a human trial, or somebody says it is in the initial phases of trial. Yes. Now, apart from drugs, I would not go to drug related issues, but in our field, you have two options available. Yes, as you said, first thing is patient preference and clinical expertise. As I said in my previous couple of minutes back, you are a clinically expertise person. You are doing a practice since last 5-10 years. You would be seeing that what are the changes coming into that particular patients or particular conditions. First thing. Secondary thing, preferences of the patient. So what time the patient needs the recovery, in what duration the patient needs a recovery during that period of time. So you can ask that patient, this is the issue with you. I'm going to administer this kind of treatment. Yes, as of now, we are not having an valid evidence. But are you cooperating with me? Patient says, yes, I am cooperating because I have trust on you. You are here to treat me. So good. So you implement on one patient. Yes. My sincere recommendation is, once you get results in that one patient also, try to document itself under your name or whatsoever it is into a reputed journal, so that a pillar of evidence is then created. So based on your evidence, I will get an idea. Okay, Dr. Saurabh has done this, so I will do it on 10 patients. Based on my evidence, somebody else will do, and so on. The story will go on, and it might be possible that at a particular point of time, we may come to know that it was just on one patient it was successful, and on 30 patients it is not successful. Yes, so we should not be afraid of this, and it may be possible that on one patient it was very good. Yes, and on 30 patients it became an excellent. Yes, so we should never be afraid of experimenting with new things until and unless it is not harming the patient. That is the basic goal of this evidence-based practices.
Actually, a lot of physios, but especially the new physios which are coming up, until unless they get the practice to be done for 5 to 10 years, what they do is they initially apply everything. For example, patients with ONE, suppose you told us, comes, he will do everything. He will apply the SWT or PEG, he will apply TENS, he will apply IFT, ultrasonic. He will take 1 to 1.5 hours. If we have given all the treatments, so we will get some results. Rather than this, what are the protocols that we should follow, or what are the treatment methods that we should choose via EPP method?
Yes. Again, coming to that, you said it that the new physiotherapist or budding physiotherapist term. So one more thing is, those people should always, I would just give you an example that on what basis you will treat a PA shoulder patient or a frozen shoulder patient. Based on literature available in the books, okay, you would see on clinical expertise, which as a budding physiotherapist, you would not be having that much of clinical expertise which a senior physiotherapist is having. Third thing is based on research evidences, and fourth thing is patient feedback. Yes, so when you are a budding physiotherapist, it becomes a bit problematic, to decide that because you are under a tremendous pressure to put your name also, that I am doing it, and this is my first patient or this is my second patient, and I need a valuable feedback from the patient. So what we will do, we'll put n numbers of treatment Yes, and then among n numbers of treatment, one is going to give, one is going to get a result. If you give aceclofenac, if you give diclofenac, if you give etrocoxib, any one is going to give you result. But we are not aware about it, which one has given. So in this cases, it is very much necessary for every individual, even for me also being a senior physical therapist, I need to discuss. Yes, so that is why these kinds of webinars or these kinds of workshops or seminars play a major role in upgrading knowledge. You know, I always believe in one thing is, once you feel that you know everything, there's an end. Yes. So if you think that I have given 5 numbers of treatment and all the patients are developing, you think about, okay, you have given 1 hour of treatment, patient is in good condition. Yes. Now just think about how to reduce the time of treatment and give good results. Because in nowadays time, people want immediate results. First thing is, people want immediate result. Why would I spend 2 hours in a day? Yes. Instead of, if I'm getting it the same result, I'm getting it in half an hour. Yes. So our field has developed enormously in last 10 to 15 years or 20 years, especially if you say it in India. You know, I always tell my students that, you know, when we used to study, the clinics were oddly painted and, you know, there was a single room. Nowadays, if you see, majority of the clinics are having ACs. Even the celebrities, even the national level people are aware what is the level of physiotherapy. Yes, and we are doing enormously good. Thanks to our forefathers in the physiotherapy who has done a very tremendous efforts in developing our field. To all the physiotherapists who are putting their efforts day and night for doing this enormous upliftment of our field. So to all of them, it is my sincere advice. Yes, it is my sincere advice that we are supposed to, we should never be ashamed in accepting or developing ourselves. Yes, if I am reading something new, yes, if I have read this, you know, this glide is increasing, this guide is increasing this movement. Yes, so in what duration, what modifications can be there, or probably if I'm giving this glide, can my taping be used to have the long-term results? So ultimate goal is again your patient feedback, clinical expertise, and the incorporating it in the systematic reviews.
Actually, you told about the components of EPP. Are there any steps to be followed for evidence-based practice? Other than the components, are there any steps to be followed?
Yes, definitely. You know, the first thing, there are steps to be followed in EBP. First thing is, whenever the patient comes into your clinic, yes, the patient, as a therapist, you should always think it as a research question, or the research itself says research. You are doing the things which are already being searched. Yes, so it is, that is why it is known as research. Yes, so you should have those components available with you. Yes, so how to formulate a research question? Yes, PICO, PICO, PICO. P stands for patient or population. P stands for patient or population. I stands for intervention. C stands for comparison, and O stands for outcome. Okay, so patients or population. So you are a clinical therapist. You know, one major thing is we forgot to discuss in our previous question. Everybody thinks that research is an academic part, and it is always done by great scientists. No, it is, everybody can do it. Everybody can do it. Research. You are seeing patient. You are seeing a population. You should come to know. I am working in Ahmedabad. I am working in Gujarat. Why I am seeing ONE cases more? Why I am not seeing OA hip? Why I am not seeing OA elbow? what is the reason behind ONE, and in which duration of time, what is the optimum age where I'm getting this population or the patient complains first time it complains of pain. Yes, first time it complains of pain when? At the age of 50, at the age of 55, at the age of 60, which is the age when the patient complains the pain. Yes, till how duration it goes, how many numbers of patient or what is the percentage of population going on towards the surgical approach. Why they are going on towards surgical approach, why they are not preserving the conservative, what they think about it. Yes, so these are the patient population questions. Yes, then I have intervention. So as a physical therapist, again our aim is to reduce pain. Whenever we used to study, we in PT final year physiotherapy, we had always PT assessment and PT management questions. So we used to write two things. Yes, long term goals and short term goals. And in every goal we had reduced pain. We had a reduced pain component. But some or other way we will incorporate that. Yes. So even your TENS works on pain control, even your IFT works on pain control, even your ultrasound works on pain control, short wave diatherapy works on pain control. Every other modality, even your manipulation works under, you have grade 0, grade 1 mobilizations which are working under. So even your exercises are working on pain suppression mechanism. Yes. So why? What is the reason why I am selecting IFT? Yes, these are number of studies which have come that, with the latest evidences, these are the hierarchy. So these are the cases wherein I am supposed to give treatment. Yes, so I will select IFT. Just giving you an example, I will select IFT. Yes, once I have select IFT, okay, next question is, can I combine it with ultrasound? Yes, can I combine it with ultrasound? Okay, I am combining it with ultrasound. So what reasons I have combined it with ultrasound? Probably local point of tenderness. Yes, that is one of the basic component where ultrasound works. So I have combined local point of ultrasound and IFT into this. Okay, so that is the reason I am using IFT and ultrasound in a patient population of OAD. So now what is the outcome? Outcome is pain has reduced. Now pain has reduced immediately. It is first week, second week, third week, or pain was not reduced till first 2 weeks and gradually it started reducing, and it had lasted for 4 weeks. After 4 weeks, does the pain come back? Yes, it comes back. Okay, then why IFT has a shorter mechanism or ultrasound has shorter mechanism of acting? Yes, so we need to have, Dr.
Yes, sir. Continue, please.
Okay, so we need to have a research formulations based on these PICO components. Yes, patient or population. I stands for intervention. Yes, C stands for your comparison, and O stands for outcomes. So based on these PICO components, you are practically devising a protocol. Yes, and mark my words, we are still following Western world. We are still following certain kinds of treatment. With this incorporation, you can form your own protocol, and if you document it in your name, I wish that every Indian physio does this, so that Indian physical therapy branch is, moving on and develops a new horizon. So this is the basic component. I don't say that we are not doing well, we are doing extremely well. Yes, but how we can open up our scopes in future horizons. So before this lockdown, nobody had thought about, these kinds of webinars or seminars. But suddenly with lockdown, people have evolved with these webinars and seminars. So that is what we need to do is, so after you define a research problem, you have a review of literature to be done. Yes, review of literature states that whether IFT has worked in different population, whether ultrasound has worked in different population, yes, I am accepting all these kinds of studies and then I am incorporating it. Then it is a critical appraisal. आपने कर दिया, इसका मतलब ये नहीं है once you have done, that doesn't mean that you are not updating it. Then again you have certain parameters, whether the pulse ultrasound will work, continuous ultrasound will work. So it is an ongoing process. Yes. So your hierarchy of evidences, I would like to show the hierarchy of evidence over here in my yes. So I think yes, this is clear.
Visible.
Yes. Yes. So case report, case series, cross-sectionals, case control, cohort, randomized controls, and meta-analysis and systematic reviews. Okay, I will show it like this. Yes. So as you move on, yes, as you move on with case reports, yes, as you move on with case report is the minimal evidence. Then you are supposed to do it with case series. As you move on up, best available evidence is meta-analysis and systematic reviews. So to all the physical therapists or to all the medical therapists, if you find meta-analysis and systematic review stating that this needed, it is definitely valid. Yes. So case reports can be a minimal evidence, we cannot neglect it, but the meta-analysis and systematic reviews, if they are in favor of our treatment protocol, this means it is a very well documented study and very well approved treatment protocol.
Meta-analysis is the gold standard of research. Is it?
Yes. Yes.
We start from the case study or case study first. It is the first step which we follow, and then we progress up to the meta-analysis stage. Is it, sir?
Yes. Yes. Definitely.
Another common question which arises in some budding physios mind, we are studying about the equipments. So how do a person decide that this equipment will be much better than the other? Which kind of evidence suggests that if the ultrasound, ultrasound is better than the IFT, or TENS is better than the IFT, or IFT is better than them? So which evidence suggests, is it all the research that is available in meta-analysis, or still the case study is going on about that?
Yes. So, see, if you have a meta-analysis study, that stating it that ultrasound is better than X treatment, I would not say the treatment name to avoid the conflict of issues. So, if ultrasound is better compared to any other treatment, yes, then in that case, we are supposed to search again that in your patient whether it is working or not. First thing, you need to discuss with among your colleagues also. We have started now. This is a wonderful approach of sharing our knowledge. Yes. So I am sharing my knowledge, stating it that I am forcing all these people since last half an hour, which we are discussing, that whatever you are doing, irrespective of whatever you are doing, you start documenting things. This is what our main aim is. We have n numbers of case reports with us. So start documenting it. To forget about, yes, and document in a very good reputed journal, so that your evidence is being nationally or internationally accepted. Yes. So there are chances that probably one journal would not accept your case, or would not accept your manuscripts based on other problems. But don't leave that. If one is not accepted, you go to second, you go to third. Please believe in yourself that you are doing your level best. And what is the level best? You are doing your level best to just treat the patient and reduce the pain. Yes. So this is what we are supposed to do it. As you said, if there is a less number of evidence available in ultrasound, and there is a more number of available evidence in X treatment or probably IFT. So initially, if you have a strong belief, yes, you go and review the literatures in the textbooks. That what is the ultrasound mechanism? Whether it is acting on collagen fibers, whether it is giving you the thermal effect and what are the non-thermal effects, what can be the possibilities, yes, cavitation is occurring, not, etc. All these things, and then we are supposed to go on and explain the patient. Yes, see, this is the thing. I am going to administer this treatment to you. Let us hope for the best. Okay. Again, if you are getting results, mark my words, do it on number of patients. At least try to do RCTs. At least try to do RCTs. If you do RCTs, this means somebody else is going to do meta-analysis or systematic reviews. So if we have 4 to 5 numbers of RCTs on ultrasound in soft tissue injuries, some or other person will come and do. It is best you do. It is best for us if we do systematic reviews, but some or other person will definitely do RCTs, and that RCT is nothing but a critical review of all the experts on all the. For example, I have stated that ultrasound is working. You have stated ultrasound is working. So the systematic review will say yes, ultrasound is working. So though the case report was positive, then it may have an effect on IFT studies also.
Right. One last question is from my side is, can you suggest some of the journals that physios would like to publish their research on?
Researches. Okay. Thanks to UGC. From I think from July 2019, our UGC has made it compulsory that the journals should be the publication should be in the journals which are listed in their portals. Okay, so that is known as UGC care list. UGC care list. If you go, it is UGC care list 1 is there and UGC care list 2 is there. Okay, care list 1 is nothing but the UGC committee has decided the parameters, and based on various stakeholders, they have put down the journal list. So that is UGC care list number 1. And UGC care list number 2 is any journal which is indexed in Scopus or Web of Science or PubMed. These three are basic databases: PubMed, Scopus, and Web of Science. Yes, all these three databases are very much important when you term it about research. So if your journal is indexed in Scopus, is it indexed in Web of Science or PubMed? Any three, if all of them, it is very good. If any one among them, yes, it is good. So try to publish in journals which are either recognized by UGC, and for internationally I would say, try to publish it in Scopus, Web of Science, or PubMed index journals only. Yes, so this is a very good, evidence. If you publish in a Scopus or a Web of Science journals, you would see that other researchers immediately. And there is another advice to all the people who are listening here is start. If you have just entered into you have just completed your bachelor's or master's, start to develop an account on ResearchGate. That is a very good website, which gives you an idea about how the evidences or researches are incorporated in your field. So once you make that evidence, yes, so if you publish in this article in Scopus or Web of Science, you upload that article onto ResearchGate, so people can see, and if somebody is doing on the same topic, they will cite your reference. So the more the number of citations, the more popular author you become. Yes, so that is very good. So that is in terms of research, it is known as rock stars. Identify the rock stars. So there are people who are always into that field. Yes, so somebody would be studying on lateral epicondylitis only. Somebody would be studying on ONE only. Somebody would be studying on carpal tunnel syndrome only. So try to identify those rock stars. So if those rock stars means, it is not a day one story. It is like 15 days, 20 days, or 15 years or 20 years work into that field. Yes. So if that person has put that work into that field, that means there is some certain amount of evidence into that work.
Thank you so much, sir. Actually, in such short time, I gained so much from you.
Yeah. I would like to show you one more thing.
Half an hour.
I would like to show one more thing to our audience. These are 5 A's. 5 A's of our evidence-based practice. Ask, acquire, appraise, apply, and audit. Yes. So ask. First thing is convert information into an answerable clinical question. So that is like what I said is PICO. PICO. Patient population, intervention, comparison, and outcome. Yes. Track down the best available evidence for answering the question, which is acquire. Yes. Then critically appraise with its validity and impact. This critically appraise can be based on your scientific or research publications, or it can be discussions among the stalwarts of your field, or even your colleagues also. Apply. Then try to apply it onto the patient population, and then evaluate the first 4 steps, and then again improve. So probably which is good today can become better and best tomorrow, or else if it is not good today, we are supposed to work it towards the better and best today. Yes.
Sir, it was half an hour session, but due to the knowledge we have gained, we have extended it 5 to 10 minutes more even than that. Thanks to you, because yes, in short time or short notice, you have given us time. You spent time with us and given this knowledge to all of our participants, our followers of the academy space, your students. From everyone's side, I would like to thank you again and again, and hopefully we will continue with education with the benefit of the participants, benefit of the physio fraternity, so that they will gain something and will continue to uplift our physiotherapy profession.
Definitely. I'm very much thankful to Academy of Exercise Health and Therapy, Dr. Saurabh also and Dr. Chirag. These kinds of efforts are very much necessary in today's world, because it is not a single-handed story where we can lift the fraternity. It is the work of all the individuals together for the upliftment of the profession, and for if I uplift, it is you are going to benefit. So it is we together should move ahead, so that we can help the patients, and ultimately we can help the fraternity also.
One last thanks to all the just cardiopulmonary physicians who are working tirelessly for the COVID-19 patients. Hats off to them. Continue your good work. We will save humanity and will fight it out against the COVID-19. Thank you so much, sir, again for joining us. Thanks a lot. It's been a pleasure to have a session with you. Thank you so much,
Dr. Saurabh.
Thank you, sir. Thanks a lot. So hopefully all the participants would have gained a lot, and thanks who have spent time with us. Do follow our Academy of Exercise in the series of webinar. It was our 10th webinar today, and on different topics we have tried to give you all the best available researches, all the best available topics. If you want to ask a question, you can